Okay, so I think it's time to start. Good evening, everybody. My name is Dr. Theodor Voronov. As a chair of Dame Kathleen Ollerenshaw Committee at the Department of Mathematics, I'm happy to welcome everybody to this wonderful event, the annual Dame Kathleen Ollerenshaw Lecture. I'm particularly honored to greet here the members of Dame Kathleen family and the trustees of the trust. Now I would like to ask Professor Chris Hardaker, the head of School of Natural Sciences, to say a few words about Dame Kathleen. Chris.
Thanks very much indeed, Theo. It's a great pleasure to be here and to talk about Dame Kathleen, who was born Dame Kathleen, or Kathleen Mary Timpson, I should say, in Withington in Manchester in 1912. She went up to Somerville College in Oxford at the age of 19 to study mathematics, and she completed her doctorate in Oxford in 1945 on critical lattices. She wrote 5 original research papers, which meant that she earned her DPhil degree without the need of a formal written thesis. In 1939, she married Colonel Robert Ollerenshaw, and after World War II, the Ollerenshaws moved to Manchester, and Dame Kathleen worked as a part-time lecturer in the maths department at this university. Dame Kathleen also became heavily involved in politics. She served as a Conservative councillor for Rusholme for 26 years and was Lord Mayor of Manchester in 1975 to 1976. She was made a Freeman of the City of Manchester and was an advisor on education on Margaret Thatcher's government in the 1980s. She was probably best known in mathematics for her work on magic squares, but she also had a formidable reputation as an astronomer, and the observatory at the University of Lancaster still bears her name. She was passionately committed to encouraging interest in mathematics amongst young people, and she had been deaf since the age of 8 and was an inspiring role model to many, therefore. Dame Kathleen held honorary degrees from both the Victoria University of Manchester and UMIST, had been a long-standing friend and supporter of mathematics at Manchester, and has continued to show strong interest and support for the new University of Manchester and the vision behind the 2015 agenda and beyond. In fact, in the Faculty of Science and Engineering, we have named some early career research fellowships after Dame Kathleen Ollerenshaw, which are open now for applications. This lecture series, the Ollerenshaw Lecture, is a prestigious annual lecture in the Department of Mathematics within the School of Natural Sciences at the University of Manchester, named in honour and of recognition of Dame Kathleen Ollerenshaw. The inaugural Dame Kathleen Ollerenshaw Lecture was held in 2007, and the lecture aims to appeal to anyone with an interest in mathematics. And so alumni, current students and staff at the university, local teachers and business contacts, as well as the Dame Kathleen Ollerenshaw family, have all been invited to this year's lecture. So I hope you enjoy it. I certainly look forward to hearing the lecture by David, and I'll pass back to Theo. Thank you, Theo.
Thank you, Chris. Now let me ask Professor Andrew Hazel, head of the Department of Mathematics, to introduce the speaker.
Thank you, and welcome to all of you. Thank you very much for coming. So it's an absolute pleasure to introduce Professor Sir David Spiegelhalter, FRS, OBE, who's chair of the Winton Centre for Risk and Evidence Communication in the Centre for Mathematical Sciences at the University of Cambridge. And the aim of the centre is to improve the way that statistical evidence is used by health professionals, patients, lawyers, judges, media, and policymakers. David is a statistician, and he's had a long-standing interest in medical statistics and the public understanding of risk. And he's been very busy over the COVID crisis, as you might imagine. He's presented BBC4 documentaries, Tales You Win, The Science of Chance, the award-winning Climate Change by the Numbers, and his best-selling book, The Art of Statistics, was published in March 2019. COVID by the Numbers came out just recently in September 2021. David was knighted in 2014 for services to medical statistics and has served as president of the Royal Statistical Society from 2017 to 2018. He's recently become non-executive director of the UK Statistics Authority. That was in 2020. So it's an absolute pleasure to invite David to tell us all about communicating COVID statistics to the media, some highs and lows. Thank you.
Thank you so much for that kind introduction. It's a great pleasure to give this lecture and a huge honor to be invited. And I'm just so sorry I can't be there to meet the audience and the family and to have a nice dinner afterwards. No, real pleasure. And I've been reading about Dame Kathleen. What an extraordinary woman. Quite amazing life. So terribly impressive. I love this detail that, I suppose it's true that at her, first interview for her post, for her lectureship post, I think it was, she didn't tell them she was deaf. And I thought that was very impressive indeed. So anyway, it's a huge pleasure to give this lecture today, which I hope will be accessible. That's the idea. That's what I do now, and so I kind of hope that it will be topical. And there'll be some questions. So I'll go on for a bit and then I'm going to stop, and I really hope there's lots of questions. And so as you go along, I won't stop as I go along, but if you would like to put some questions in the chat, that would be great. And then I can have a go at answering at least some of them at the end. So please join in and ask me what you want. And if I don't know, I'll just say I don't know. I've got used to doing that, as we'll come to. Okay, so I'm going to share my screen. And so what you should, I hope, be able to see the slides now. Okay, so just as a quick reminder, as Andrew mentioned, I'm now a non-executive director of the UK Statistics Authority. That's the body that runs, that looks over the Office for National Statistics and the census and all the official statistics in the country. And so keep that in mind. There will be some conflicts of interest when I say how wonderful their work has been. Okay, so a bit of background for me. I used to do statistical methodology, more mathematical sort of things, probability in AI, Bayesian methods in clinical trials, complex Bayesian modeling using Markov chain Monte Carlo. And I used to do all that stuff, and it was great, really cool. But I was really fortunate, good 14 years ago, to be philanthropically funded by David Harding, a hedge fund manager, who was interested in a way, better communication about risk in society. And that enabled me to change my job into a kind of performing role. And I then tried to go off and do the sort of Brian Cox of statistics business, and as been mentioned, making TV programs, getting on the media, talking about stats. But now David Harding has funded the whole gang of us. This is, there's nearly everyone. There's a few more that aren't even there. This is an extraordinary group of people. The Winton Centre for Risk and Evidence Communication. It is unique, absolutely unique, and it could never be funded, I think, apart from a benefactor, because it's an odd mix of psychologists, mainly psychologists. It's in the maths department, but they're nearly all psychologists, web designers, communication professionals, ex-BBC people, and me. And in fact, John Aston is on the left, who's also now part of this. He sort of replaced me in the chair, and he's another proper statistician. So and we work on communication, and we've been very busy around COVID, and we'll come on to some of the work later on. Okay, and of course I've written popular books. We mentioned that. It's a good book, sold very well. Nothing like a pandemic for selling popular stats books. And this one's just come out, and it's quite good. I was looking around for a copy. Oh, here we are. Yeah, here we go. Ta-da! It's honestly, I got to plug the book. I'm afraid you start writing books, you become ruthless at self-promotion. So there's been a lot of data about over COVID, and you've heard those numbers every day in the news for more than a year and a half now. That was the summary end of yesterday of for the UK, the coronavirus dashboard produced by what was Public Health England, now the UK Health Security Agency. showing number of cases going down, deaths looking as if they're starting to go down. Patients admitted, that's actually is going down now, because that only goes up to November the 2nd. There's about a week's delay for that data. If we look at English data, hospitalizations are going down. And so it's an interesting time. And you could ask me about what do I think is going to happen, if you want, but I won't be able to say. Okay, so that's some data. It does depend, of course, on which day of the week things get reported. I mean, this is quite a nice example of when you've got to be careful interpreting the statistics. The daily number of deaths, what was it yesterday? This was, we've heard 57 deaths. Yeah, but that was because that was a Monday. And it's always low on Mondays, on Sundays and Mondays. And it goes up on Tuesdays and Wednesdays. And Wednesdays is usually about twice what it is on Sundays. So this is just, how you would interpret the pandemic would depend crucially on the day of the week. But that just shows the limitation of this rapid number, the deaths within 28 days of a positive test, which is not a great number. It's okay as a daily surveillance technique, but it's not the best number to use at all. For that, we should be going to Office for National Statistics with about a 10-day delay when we hear about death registrations, what's actually on the death certificate. So this was the data that came out this morning from Office for National Statistics. Their graphs have really improved a lot. I'd like to just notice a few things about graphical display. First of all, the main sort of take-home message is in the title. It's not buried in the text somewhere. So it's integral part of the graphic is the main current take-home message that we're above the 5-year average. The black line is the 5-year average number of deaths. The blue are deaths involving COVID. Green are deaths not involving COVID. Now, this line is very bumpy because this is death registrations. And as this points out, if the registry office is closed because of a bank holiday, there's a dip. And then a spike, then a peak the next week. So again, we get a little explanation on the graph, which is very useful indeed. This I could give a whole lecture just on this graph. Just looking back at the first wave, we can see an enormous spike here, double the normal number of deaths in the first wave. I mean, just staggering excess deaths here, and also excess non-COVID deaths. There's green above the black line. These were COVID deaths. I think everyone is sure about this now. They weren't testing at that point. Doctors were given a dispensation to sign a death certificate, even if they hadn't seen the patient recently. And sadly, we know a lot of older people died in care homes without being tested, and their deaths were not put down as COVID because nobody people weren't confident about it. Very different situation in the second wave, where we see there's actually a deficit of non-COVID deaths. You see, there's fewer green deaths than normally we would expect. What's going on there? Multiple reasons. Possibly one of the main reasons that there's no flu. All these measures we're taking with our masks and distances just stopped flu last year, and looks like possibly it may slow it down this year as well. So that saved 10 to 20,000 deaths. And then, of course, some people who died here would have died later the next winter. And so these deaths were brought forward to the first wave, what's called mortality displacement, or actually a fairly official term, which is very unfortunate, called harvesting. That is, if you Google it, that's the term used for when deaths are moved usually because of weather or something like that. At the moment, it's quite interesting. There's some excess deaths. It looks like there is a small excess non-COVID. Now, actually, I don't think that's there. This is based on a 5-year average number of deaths between 2015 and 2019. The actuaries have said that if you adjust for the fact that the population's aged, there's been no excess non-COVID deaths recently, which is a huge relief, because the anxiety that's been expressed the whole time is that because of the massive disruption of the health service, delayed cancer appointments, delayed operations, real mess, that could be leading to additional deaths. There's no sign of that yet. but we'll have to wait and see. Okay, then we dig deeper. As statistics never tells you the answer. It just raises questions again and again. So this looks at where people have been dying. And again, the main conclusion is in the title, that where the deaths were above the 5-year average in private homes, hospitals, and care homes. But the main issue here is what's been happening at home. So this is called a small multiple. When you have the same graph with the same axes, but with different contexts, because the eye is very different, very good at spotting then is at looking at these multiple graphs. This is the most amazing story, one that hasn't received enough attention. Right through the pandemic, substantial excess deaths at home, around about a third more. People are dying at home than used to. Nothing to do with COVID, really. Very few of these are COVID. There's no sign of it changing. No, it doesn't change when there's no virus or where there's lots of virus. It just carries on. And I think it could be a continuous, possibly a continued change, sustained change in where people are dying in this country. And you can understand why people don't want to go to hospital. People don't want to get referred to hospital. They don't want to go because, many people have caught COVID in hospital. Maybe 1 in 6 people who have COVID in hospital caught it in hospital. So it's quite reasonable for people to avoid going, and actually dying in hospital during the pandemic, while it's never been, perhaps a very positive experience, or positive as it could be, has been even worse. And most people would prefer to die at home. So possibly this might be a good thing. Or is it? Or is it not a good thing? We don't know. And I think this is one of the big absences that I feel quite strongly, is that we don't know about the quality of end-of-life care. So statistics just generate more questions. Is this a good or bad thing? We don't know. Okay, so that's a general point. Okay, so I'd just like to just whip through some recent bad stats. I want to talk about stats in the media. Let's have some bad ones. Just over the last week, it's been a real week of bad stats. There's been some real crackers coming out. This was a good one just a week ago, 2nd of November. COVID deaths up by 15% in a week, with 293 fatalities recorded in just 24 hours. Now, you can absolutely guarantee that that is on a Tuesday or a Wednesday. In fact, it's on a Tuesday because there's always a huge spike on Tuesday. So we know that. And that 293, those big headlines, it turned out that there was a technical fault, is that the system used to collect the daily data wasn't working on Sundays. So on Sunday, only 40 were reported. So it jumped from 40 to 293. Now, come on, this is not sensible. So to make a big thing of the 293 is ridiculous. It's a pure artifact of the reporting. Okay, so that's the kind of picture. And then we had this one. I don't know if you saw this on Monday. The chief executive of the NHS England, in an interview with Sky News, said, "We've had 14 times the number of people with COVID in hospital than we saw this time last year." That is completely wrong, completely untrue. This shows a nice image from Full Fact. The number of COVID patients in hospital last year and this year. There are currently far fewer patients in hospital with COVID than there were this time last year. Back in August, when last year there was the Eat Out to Help Out with very low rates, there were 14 times the rate back in August, but not now. So that was not a great bit of stats communication. Then we got another one. Susan Hopkins on the Andrew Marr show on Sunday from UK Health Security Agency. We're still seeing deaths in mainly the unvaccinated population, but increasingly, because of immune waning effects, there are deaths in the vaccinated group as well. This is just not true. If we look at deaths recently, and I'm sorry about the table, I haven't got time to draw a nice graph, I'll just point it out. For months, the majority of COVID deaths have been in people who have been vaccinated. For months, that's been going on. Nothing to do particularly with the waning vaccination. So here we got deaths over a 4-week period these are the numbers among people who are not vaccinated. These on the final column, these are the numbers of about people who've had 2 doses. Hugely more than the people who are not vaccinated. The great majority of COVID deaths at the moment are in older people who have been vaccinated, people like me. And so that's why I was very pleased to get my booster, and why it's absolutely essential that these older people get their boosters, because that will help a lot reduce this. Okay, we'll come back to that business about vaccination and cases and deaths later on, because it's a very important issue. But we tried to explain, back in June, we were writing about this, why most people who now die with COVID in England have had a vaccination. It's not a bad sign. It's exactly what we'd expect from an effective but imperfect jab. We'll come back to some of those arguments and stories later. So this story's been going on for ages. Most people who die with COVID have been vaccinated. This was not appreciated by some. I'm on Twitter. I got, very large number of followers, but in fact, I don't get that much abuse. I'm white, I'm male, I'm old, and I don't get too much, pushback. But we got a real cracker back then in June. David Spiegelhalter, Anthony Masters, and the entire lying, genocidal editorial board of The Guardian should be hunted down and destroyed for crimes against humanity, period. Whoa, that's quite strong stuff. It did, in fact, get this guy banned from Twitter. That was considered a threat, and they were banned. But how do you respond to that? And Anthony started the tone, I thought, rather well. My co-author, who said, that seems harsh. I thought it was a good article. So I chipped in, so yeah, a bit harsh. I've had worse referees reports. And then it just, mushroomed into people sending in mock, editorial comments. Referee 2 thinks you are genocidal and should be destroyed. And I invite revisions to your paper. So we're lucky because we don't get, that much abuse, a certain amount. And we tend to just be able to shrug it off, which is good. Anyway, it's been a busy time. National stats organizations have been, I think, doing an amazing job. They've had to be incredibly agile, fast moving, running the COVID infection survey and so on. So I would say that, but I think that they've been doing a really good job. Huge demand from the media for comments from experts, and I suppose I'm kind of an expert. I don't know if you know about it, but there's a wonderful organization called the Science Media Centre that puts journalists in touch with experts, and I do a lot of stuff with them. And it means that we get announcements and papers under embargo. We get them before they're published, at the same time the journalists do. So we absolutely must keep them confidential, but we can write comments which then go out to the journalists, which is how you get quoted. You've got to get quoted, you've got to see this stuff the day before in order to get your quotes in the news story. A day later, it's too late. You've got to be part of the news cycle. I think most journalists have acted very well indeed. I've hardly been stitched up at all, especially the specialist ones. Political ones, not so good, but the journalists have acted very well indeed. Excellent work by fact checkers, people like Full Fact. It is a problem to remain non-aligned because you do constantly get asked, what do you think? What do you think is going to happen? Speculate and blame. Who do you think, should they have done this? What do people do wrong? And I just have to say all the time, sorry, I don't do that. Not my job. And I could tell some more stories about that. We've, in fact, Kevin McConway and I have written an article for statisticians on doing media appearances because we've done so much. Sound human. First bit of advice. You don't have to go through all of those, but as a whole, you just have a look at those. Those are the kind of list we had of the tricks we had learned. Actually, we missed one trick there is that we didn't do is just be careful about the media. I did a live, we say it, look at number 13, you'll get things wrong. Don't agonize about that. Yesterday, live interview on Sky News using Zoom. I forgot to unmute myself. Imagine it, live on thing. I forgot to unmute myself. So that, it happens. It still happens. You get it wrong. Shrug it off, start again. But the crucial thing, I think, is which we emphasize again and again, don't be pulled into someone else's argument. Stick to what you know. Don't go beyond it. And I could talk later if someone wants to ask questions about the role, whether I should be advising on policy. I don't think so. Okay. I made every mistake. Everything's gone wrong. I made every mistake. I don't know what you think about this one. This was an analysis I did back in March 2020, incredibly early, just about the time of the first lockdown. I think it was March the 23rd. So it was very early, and it was based on the data from the, that famous Imperial paper in March the 16th that was said that would led to the lockdown. They had some slightly buried in there. They had some really good statistical analysis based on very early data from Wuhan. You remember the Diamond Princess cruise ship, in which they estimated the infection fatality rate, the chance of dying if you were infected. And they, those black dots are those chances. Now, it's on a log scale because it increases so fast with age. The chance of dying if you catch the virus doubles for every 6-7 years that you're older. This virus hates old people more than anything else. More important than any other factor is age, which is why, of course, when they rolled out the vaccine, it was done pretty well strictly by age. So, and someone pointed out, I didn't spot this at first, someone else pointed out, well, how does this compare with a normal chance you'd have of dying during the year? And when I plotted them, you could see they went along very closely indeed. So the conclusion was that, which I was saying back in March 2020, the risk if you caught COVID was similar to the risk of dying this year from other causes. And it's now it's not so true with vaccination, but before vaccination came along, that was really true. And later on, I did some analysis with Ben Goldacre's excellent group, where we showed that it's not just age. The risk factors for dying from COVID are almost exactly the same as the risk factors for dying from other things. In other words, COVID works by exploiting any vulnerability that you've got, whether it's due to age or any sort of illness. That's why most people who die with COVID have got something wrong with them, 90% or so, because it exaggerates any vulnerability or weakness you've got. It pumps up your risk. We say the virus is a bully. It just picks on weakness. So I thought this was quite a good, useful thing to say for people to calibrate their risk. But this was misinterpreted. Katie Hopkins, bless her, before she was banned from Twitter, had 1 million Twitter followers. And she said here, fact-based tweet, corona deaths are not outpacing what is normal or usual. And that's from me, graph from Professor Sir David Spiegelhalter at University of Cambridge. And the BBC redrew my graph like that, showing the dots going along the normal death rate, the line, which is the normal chance people have got of dying. Now, the point is that what this means is that if you get COVID, your chance of dying in the next year is doubled. You've got your normal risk plus the chance of dying in the next 3 weeks of COVID. So it's not the same. It's the same number, but that means if you've got both of them, it doubles it. I thought, oh God. And then the Sun headline, your risk of dying is no different this year despite coronavirus pandemic, says expert. That's me. Just a disaster in communication. I got the headline changed. It's not, it's not great even then. But even so, a complete disaster in communication because I didn't keep on saying that means it doubles your risk. I should just kept on and on saying it doubles your risk. In fact, it's interesting. The Imperial Group redrew the analysis. This was based on very few deaths, based on about 80,000 deaths, and got exactly the same figures. So this was extraordinarily robust finding. Chance of dying if you catch COVID is about the chance you've got of dying in the next year anyway, before vaccination. If you're vaccinated, you're likely to get a milder disease, and so that risk goes down quite a lot. Okay, I mentioned before, my co-author Anthony Masters, that we've written an article in the Observer now every week since January. I think we've done 45 or something like that. And then it goes on the Guardian website, but it's in print in the Observer. Interesting challenge. I don't know if any of you have tried writing articles or even blogs or anything where you're only allowed 350 words. It is unbelievably difficult. It's more than twice as difficult as 700 words. Which is a standard sort of length for an article or a blog. 350 words is really challenging. So anyway, we're still bashing them out. we just decided today what we're going to do for next week. Okay, so looking back on 2020, I'd just like to make some observations that we wrote in our book, because I ended up, that those articles led to our book that I co-wrote with Anthony Masters. We never met, we just wrote the book together. Some things we picked up on for 2020 that I just think are quite interesting, that the media, again, haven't always picked up on when they might have. This one, the yellow might not show very well, but don't matter about that. This is fascinating. This was in a paper in Nature, in Science, which looked at, using genomic sequencing, the introduction of the virus into the UK, how it came in. And the point is that it didn't come from China. It came from France, Italy, and Spain. And it came in early March, not even in February. It was mainly in March, and in huge numbers. And so what they had was about, it meant that there was about 1,000, more than 1,000 independent outbreaks right across the country. We are a nation of travelers. Vast numbers of people go on holiday in March to France, Italy, and Spain, and they brought back the virus. It wasn't helped. The Spain, you see that peak is about middle to the early March. That March the 10th was the Atletico Madrid match against Liverpool, when 3,000 Madrid supporters came to Liverpool. If they were in Madrid, they wouldn't have been allowed to go to a football match, but they were able to do that in Liverpool. So what that meant, and here's a really nice picture, which is a beautiful animation from an Office for National Statistics analysis, is that when the epidemic, it erupted across the entire country almost simultaneously. Look how in France it's highly concentrated, in Italy it's highly concentrated, in other countries very highly concentrated, right across the UK. Whoa. Very difficult to stop because there were no travel restrictions. And once you've got 1,000 separate outbreaks happening, very difficult to stop, even if there had been and they'd given up on community contact tracing. So we were in a real mess very early on. Predictable. Well, we didn't know, and we weren't testing, so we didn't know this was happening either. So that was the real problem. Other surprising facts, again, going back to this age effect, over 90s, 35,000 times the risk of children in terms of the deaths from COVID. And this goes back to what I showed before, is that the risk of dying from COVID is related to the risk of dying from other things. And what that means is that the average age that people die from COVID is the same as the average age they die from other stuff, because it's the same risk factors that influence you dying from COVID as dying from other stuff. So that's, I think, an important point to take home. And people don't quite realize, I think, how steep the gradient is in terms of how risk increases with age. Here's a surprising fact. The pandemic has been a lifesaver for young people, an overall lifesaver. 300 fewer 15 to 29-year-olds died in 2020 than would normally be expected to die. There's 300 fewer grieving families in which a young person has not died. Of course, they don't know who they are. We have no idea at all, because the person's wandering around, fit and well, who would otherwise have died in a road accident or from violence, drunken accidents, or whatever. And there were 115 deaths in that group from COVID. So it's been a net lifesaver. I'm not saying it's a good thing that you keep young people locked up just in order to save lives. There's been a big increase in anxiety and depression, and we're going to see a long shadow of this in the future. But it has been a net lifesaver, the measures taken against COVID. Now, I'd like to just get back to a point that came up in an earlier bad statistic. About fact, remember that most people who die of COVID at the moment have been vaccinated. Now that sounds quite strange. It's not what people expect. People think that, oh, the deaths are in the unvaccinated. Well, no, that's not true. So the numbers have no way of speaking for themselves. This is a lovely quote from Nate Silver. We speak for them. We imbue them with meaning. We have to be incredibly careful when we interpret data. What does it mean, the fact that most deaths are from people who are vaccinated? What does it actually mean? So let's look at cases. Again, a boring table, and I'll just lift out some of it here. Okay, so this is from a few weeks ago. in different age groups, 40 to 49, 70 to 79, the number of cases in unvaccinated people compared with the number of cases in fully vaccinated people. And what we see there, this isn't deaths, this is cases, overwhelmingly, the majority are in fully vaccinated people. The vast majority of all cases in older people have been vaccinated. So, yeah, okay, that's the fact. It is a number. These are true numbers. So, but what about the interpretation? What does this mean? Does it mean vaccines don't work? No, it doesn't mean that at all. Just like the fact that most deaths have got COVID, have been vaccinated, doesn't mean that vaccines don't work. The point is that nearly everybody over 40 has been vaccinated, and the very vulnerable groups have been vaccinated. Vaccination is not perfect, so there are breakthrough cases, there are breakthrough deaths. So the analogy we made, which again someone else suggested, I didn't think of this one. Actually, I think maybe Anthony thought of this. That most driving fatalities are wearing seatbelts. Doesn't mean seatbelts don't work. It's just that nearly everyone's wearing one and they're not perfect. So it's difficult intuition there. So that's, we have to really, work. We really worked hard to explain that. But then it got even more complicated. Because Public Health England published this graph. Okay, this shows for over 40s, the case rate, in others per 100,000, was higher in the vaccinated than the unvaccinated groups aged between 40 and 80. So now this is really difficult because, hang on, this isn't just because more people have been vaccinated. This is saying even allowing for the number of people in those two groups, the actual case rate was higher in the vaccinated group than the unvaccinated. How can this be? And it's really, whoa, what's going on? Well, and Robert Peston spotted this, tweeted it out, wrote an article about it, and it went viral. Anti-vaxxers picked up on this, spread it around the world. The basic problem is that those numbers should never have been published, I don't think, because the basic problem, we don't know how many people there are in the country. People think we do know, we don't know. That's why we need a census and so on. Let's look at people aged 40 to 49. If you look at medical records, people registered with their GPs, it estimates there's 8.1 million people in that age group, what's known as the NIMS database. But lots of people are registered with more than one GP. And people have left the country and are still registered with the GP. If we look at another source of information, Office for National Statistics estimate there's 7.1 million people in that age group. That's based on the old census from 10 years ago, with some revisions for births and deaths. That's probably that's not a very accurate. That's why we need another census. It's not great. It's better than 8.1 million, but it's not great. We do know as a fact that 6.4 million in that group have been fully vaccinated. And what we want to know is how many unvaccinated people there are in that group. Well, are there 1.7 million or 0.7 million? I mean, it's a huge difference. It makes a massive difference to the denominator. What's in the denominator? If we assume the ONS estimates, we get a very sensible conclusion that there's a higher case rate in the unvaccinated than the vaccinated. But if we don't with the NIMS data. So what a mess, what a mess. Anyway, we wrote an article about this. I don't think they should have published it. Anyway, we wrote an article about this. The data fed international conspiracies theories and full fact forgotten about. This is the most appalling thing I've seen. President Bolsonaro in Brazil arguing that the vaccine spreads AIDS. And part of his argument is based on a document produced by an organization that uses that table from Public Health England. So he is looking at, this is UK data being used to spread conspiracy theories, which I think was a real shame. And I think that's all I can say. Very unfortunate. Just to finish off now, how am I getting on? Oh, yes, yeah, I'll just finish off now. I'd like to talk a bit about trust, talk about more general issues. And whenever I want to talk about trust, because really we're talking about trust in statistics. I always go to Nora Neal. She's another wonderful woman, like Dame Kathleen. Baroness Nora Neal is an extraordinary woman. You know, she's a philosopher, but she's a real jobbing philosopher, a real roll your sleeves up philosopher who gets involved in projects, and she's done a wonderful 9-minute TED talk. I really recommend it. You know, there's jokes and trust and Kant and this sort of thing, philosophy of Kant, everything in there. So she says, and it's a brilliant insight, organizations shouldn't be trying to be trusted. They shouldn't be trying to increase trust. And that's a sort of utilitarian outcome that you want. She's a philosopher of Kant, duty, and not that I've read any Kant, duty ethics. She says they should be trying to demonstrate trustworthiness. Isn't that brilliant? Just switching the responsibility from the audience to saying, oh, why don't they trust us, to us saying we must be trustworthy. We have to earn that trust. Number one, that's a number one priority. Then if people trust us, that's good. But the number one priority is to earn that trust by being trustworthy. She's had a huge influence. The Code of Practice of Statistics, which of course I would support this because I'm on the board of the UK Statistics Authority, not the most riveting reading, perhaps, unless you suffer from insomnia. But trustworthiness is the number one pillar, along with quality and value, for official statistics in this country. So trustworthiness of statistics is absolute core principle for stats in this country. Really great. And I was on Andrew Marr, back in May last year, complaining about the daily briefings. I use this term. They were just pulling lots of huge numbers out. I said it was number theatre. This is not trustworthy communication of stats. For me, that's the sort of almost the worst thing I could say, the harshest thing I could say. That went viral as well. So you can just see that's what you do to get lots of coverage. Just be abusive about the government. We've in our Winton Centre, we're trying to codify a sort of principles behind trustworthy communication of evidence, of statistical evidence in particular. And our number one, here's a list we've got in Nature to inform, and you have to decide, are you trying to inform people or are you trying to persuade them, manipulate them? And if you really think you're trying to inform them, then decide and go for it. And that means you've got to be balanced. You've got to show the benefits and harms. You've got to show the winners and losers, the positives and negatives. You have to show both sides of the argument. Doesn't mean they're equal, but you have to show both sides. And you have to be upfront about the uncertainty and talk about the quality of the evidence and whether it's very good, how much you understand. You have to have that humility. And the other one is you have to what you also have to do is get in there hard and correct misunderstandings, pre-bunk misinformation, which we could talk about later. I haven't got time to talk about that now, but anyway. So we made an effort on this when we were asked by MHRA back in April, when they were having the blood clots associated with the AstraZeneca vaccine had been identified, those really serious blood clots in the brain. And there was a press briefing in the afternoon, and we got the data in advance. We did some statistical analysis and produced some graphics overnight. This was Alex Freeman and John Aston did most of that work. And I had a conversation with Jonathan Van Tam in the morning, and then he went on stage in the afternoon on a live live public briefing on television to explain why the COVID vaccine, the AstraZeneca vaccine, was no longer being recommended for under 30s. And he used our slides, and I thought, oh, good, he's not going to try to go through, and this is what he used. He's not going to try to explain that. This slide's one of the most complicated slides we've produced to a general public audience, and he did it, and he did it really well. He's a great performer. He's very trusted. He took it slowly. He treated the public with respect and took them through it. And basically, this is a benefit-harm balance. Harms due to the vaccine, this is these nasty blood clots per 100,000 people. In the situation where there's a low exposure risk, which there was back in April, now we're in, be considerably higher than that, and showing the age, but it's crucially you had to stratify by age because it's a massive difference depending if you're in my age group up here, the low risk, and it increases considerably for younger people. Whereas the benefits, and we chose intensive care admissions as being roughly equivalent, gets hugely bigger as you get older. There's a no-brainer for people my age what you should do, but for 20 to 29-year-olds, look at this risk benefit balance. well, it was decided that it wouldn't be recommended for them. So Jonathan took them through very, very nicely, and this became very popular. This image, again, when it became very popular and was used by all sorts. We translated it. We did it for Italy and Spain, and the European Medicines Agency started using it, and so on. So that was sort of essentially summarizing, I don't know, encapsulating our approach. Yeah. Okay. Back to Honora Neal. Just a final thing to talk about communicating data. Again, I'm a statistician. I feel very strongly about this. How can you do trustworthy communication? She's come up with some very nice principles, what she calls intelligent openness. Because transparency isn't just about going blah and shoving it all out in huge PDFs. That's no good. You've got to make the data or information accessible. People have got to be able to find it. It's got to be intelligible. People have got to be able to understand it, and you should check that. That's why I work with psychologists, because they check it. It's got to be usable. It's got to answer people's questions, their genuine concerns. That means you have to listen to audiences. First rule of communication: shut up and listen. And then, and this is a really clever one, I think, it should be accessible. Experts, and most people will just accept it, but people who want to check the working, experts out there, NGOs, anybody, should be able to do so if they want. Dig down and find the working behind your claims. Very simple principles. I think they're so beautiful that she could encapsulate so much wisdom in such simple form. Okay, so to conclude, top quality stats are essential, requires resources and careful coordination, trustworthy communication, vital to all stakeholders. And I'm just talking about stats, but I think it holds throughout. It's a wonderful sort of banner to have trustworthy communication. So just to finish off, just as a final little warning about what can happen when you speak to the media. I was on the Today program last December discussing possible Christmas rules, and I said raised voices could spread the virus, and that maybe singing may be banned. And in fact, our choir, for our carols, we had to do it outside, 2 meters apart, wearing masks. We did it. It was all right. And then I thought, oh, well, let's lighten this up a bit. I said, well, maybe a good idea to ban family arguments. I mean, nothing worse than a badly ventilated room shouting at each other across the turkey. This was a joke. However, by an hour later, in the Express, Christmas warning: families could be banned from arguing to prevent COVID spread, according to a leading British statistician. I thought, yeah, that's a bit of successful communication. Well, I think it was. At least it was a good, I thought it made the joke quite funny. Okay, so I'm going to stop now, stop sharing, and hope that there are some questions. And I've left some time. Cool. That's good. 45 minutes, as promised. And so I'm happy to try to answer any questions. But also, as I said, if I don't know, I'll just say no. Thank you very much.
Thank you very much, Sir David, for this very illuminated lecture. Let's thank the speaker. And questions?
Andrew, you're going to channel them.
So we do have a few questions that people have been typing in the chat. So in the right order. So the first one is Emma Fair. What's your biggest frustration when trying to communicate statistics and seeing people misinterpret them / media misconstrue them? And is there one thing that you wish people seeing graphs and statistics on the news would understand? Oh,
that's really tricky. I mean, I hope people have improved. I haven't got data for the evidence for that, but people have seen so many graphs and so many numbers over the last 18 months. I kind of hope that people have got better at interpreting them. I suppose the biggest frustration is a bit like that 293 deaths one. It's just when there's a number out there and people get the wrong story from it because they haven't bothered to work out, because it's a big number, they haven't bothered to work out actually whether it's very big or not, what it means. And I think that not in a, you can make, those bad stats I showed, some of them were just wrong, and that's obviously annoying. That's often not the case. It's usually that the number is right. It's just that the interpretation is wrong. And I think people jumping to an interpretation, sometimes willfully, of course, but sometimes just wrongly, just because, that's what that means. No, that's not what it means. And so, I mean, I suppose, I used to do complicated mathematical stuff, and now I've gone right back to thinking the most important thing is, what does that number actually mean? What are they actually counting? Right back to really basic stuff. So I suppose my frustration is that people don't bother to find out what the actual numbers mean. Yeah.
Okay, thank you. And then following on from Riccardo Monfordini, saying that a well-presented graph is worth 1,000 words. Why are the media reluctant to use them, do you think? And for example, why don't you use more graphs than writing in the Guardian?
Well, we're not allowed them. No, we got to do 350 words, no graphs. We've only got sort of 3 inches at the bottom of the central page because it's in the newspaper, it's printed. So, and that's an interesting challenge. Not only the 350 words, but no graphs. Whereas a book is stuffed full of graphs because you can get so much in them. I think, again, the media, you never used to see line graphs in the Daily Mail or the Sun or things like that. They're there all the time now. I think the media have got a lot better, a lot more prepared to, in a sense, assume the audience are not so daft that they can understand things if they're clearly labeled and clearly explained. So that's why I think the progress that ONS have made with their graphs is very good. You want labeling on them. You want something that tells you what the main message is. And they've got to be, nice design, clear colors and things like that. Clear layout and not too much junk and, frittery. So we know some of those principles. So I think things have improved a lot. And I kind of hope the media is not going to go backwards. There is a big new enthusiasm for data journalism, I think. And I kind of hope those improvements will carry on. Don't know. Yeah.
Okay, a short and sweet one now. From Glenn Salter?
Yes.
What's your favorite theorem from statistics?
Oh, I wonder what that could be. I wonder if it could possibly be Bayes' theorem. Sorry, I'm a committed Bayesian. We could talk about this for hours if someone wants to ask me about it, but probably best not. So I was brought up, very much within a particular school of thought of statistics and probability at the Bayesian school, which actually at its core, which I hold, is that probability doesn't exist. No, it's a virtual quantity. How do you measure? Where's probability? Show you how to measure a probability. You can measure heat and weight, and distance, and all that. So you can't measure a probability. It doesn't exist. It's not out there. So we just made it up as a useful sort of fiction in order to explain some things that happen. So that's quite an extreme view, which I do hold. These are not objective numbers out there in the universe that we're trying to measure. So all probabilities are actually just assessed. They're a matter of opinion, except possibly at the subatomic level, as what Stephen Hawking used to call predetermined probabilities. I think those possibly could be considered as existing, as not being conditional. Otherwise, all probabilities are conditional and they're all judgments. So that's quite an extreme view, which I hold. And so and of course, you revise those probabilities through Bayes' theorem, which is the formula that tells you how to learn from experience.
Thank you. So following on from that, from Martin Egerton, by risk, do you mean probability when you say the risk of COVID?
Oh, that's very interesting.
Is risk a good term to use generally?
No, risk's a terrible word. I try to avoid it now. I was the professor for the public understanding of risk, and the first thing I wanted to do was to say, well, I don't understand what risk means, because it can mean almost anything. It can just mean a probability, but it could mean, often it means a sort of mix of a probability and some sort of harm that might occur. Can you have a good risk when it's a positive when there's an upside? I don't like the term risk at all. I try to avoid it in order to make much clearer what I'm talking about. It's all right very well as a sort of general term to define about a situation where various things might happen and some of them might be bad. And that's about it, I think. But I suppose I do sometimes use it as a shorthand for a probability. But I don't like the word probability either. In all our work with communicating risk or whatever chances or probabilities or anything, we never use the word risk, probability, or chance, ever. Absolutely banned. So we will only ever talk about essentially when we design things for patients, like what their prospects might be after their cancer treatment, is all to do with, well, what we would, it's all to do with expectations. And from 100 people who are not, who ticked the same boxes that you did, in other words, who are like you, according to those limited factors, we would expect in 10 years, so many to be alive, so many to have a recurrence, etc., etc. So no word of risk, probability, or chance, purely thinking in terms of expectation. And there's a very sound basis for thinking of all of probability theory in terms of expectation, and which I strongly follow. So we only think of it, but we express that expectation in terms of what does it mean for 100 people. This is not a frequentist interpretation. We're not talking about long run frequencies. We're talking about it using that as a metaphor for actually what is an expectation.
Okay, thank you. So a couple of questions about schools and education. So from Eleanor Walker, do you think some sort of statistical understanding should be taught in schools? Now it's clear that it's a key public skill. And then a related question from Dr. Rangabashayam. How can we increase the visibility of high quality data and convey its importance to our high school students?
Oh, good. This is the most important, Eleanor, thank you. But this is the most important question. God, I wish someone could tell me. It's not part of maths. I mean, I do not think that data literacy should be taught as part of mathematics. It's not math. There's judgments involved. There's critiquing stories. This is not math. Uses some mathematical skills. It's not part of maths. And so, I'm part of a working group in the Royal Society that's looking at mathematical futures, the future of mathematical education, not mathematics education, mathematical education in the next 20 years. And we've done a call for views. And the overwhelmingly important thing that people ask for, both in terms of professional skills and also an informed citizenry, is data literacy. Being able to critique numbers and deal with numbers and understand the limitations of numbers in the news and things like that. That is, and to some extent, models and things like that. That is the skill that people, but it's not maths, a lot of that. It uses some mathematical skills. So how do you get that into an appallingly siloed curriculum where everything has to come under a subject heading? I think it's extremely difficult because it cuts right across the curriculum. It's into geography in particular, but it's into science, of course, but also every subject, in a sense, almost, not quite everyone perhaps, has got idea of data literacy, of critiquing evidence, numerical evidence. So if someone could tell me exactly how to get that best into the school curriculum and actually train, help students become informed citizens in a way that'll help them, I'd be really grateful to know, because we're trying to, make recommendations for this. Yeah, obviously probability should be taught as, I think, very strongly as part of the maths curriculum. It's very important. Statistical inference has got a role in that, probability-based statistical inference. But actually, a lot of the ideas of stats, as I deal with in my Art of Stats books, are not particularly mathematical at all. They're much more to do with ideas of bias and selection and ideas of that, which is not really part of maths. Very difficult. I'd love to know an answer.
So answers on a postcard, please.
Yeah, answer on a postcard for how to reform the education system to improve the data literacy.
So then from Paul Allen, is the job of ONS simply to get the stats out, or should there be more joined up analysis?
Yeah, thank you, Paul. That's a bit of a plant. No, it's not just getting the stats out. I think it used to be seen as just getting the stats out and their job was just to do the reports for 9:30 on a Wednesday mornings. No. There's a huge amount more now. If you think of the agility that it's had to have over the last 18 months, the COVID infection survey is answering policy relevant questions week after week until about, waning in vaccine effectiveness and all things like that, all being estimated by ONS and with their academic partners, but essentially these are ONS outputs, and the number of academic papers that ONS have been authors on, the policy relevant work that's been done with that. No, it's changed completely its approaches. You know, statistics for the public good. And that's not just getting the numbers out. That's helping people, that's Nora Neal stuff, making sure that they, you know, it can be interpreted appropriately, that it answers people's questions, that it's helpful for people, and so on. No, they're really following, I think, Nora Neal's guidance on this. And so it's a terribly exciting time. I would recommend anyone now to go into data science and stats. And there's another issue, it's the government is really picking up on this now. Michael Gove in particular, I think largely probably due to Dominic Cummings pushing it, has been pushing a data science masterclass that was designed from the number 10 data science unit, a new institution. I went down to number 10 to film. I met Larry the cat. It was great. So I'm in that, and lots of other people are in that, and that's now been taken over by ONS. And literally thousands of senior civil servants, ambassadors, ministers are doing this data science masterclass to learn about, not to do it, but how to use data science better. And then there's this integrated data system science project. What's it called? Integrated. I forgot what does the S stand for? Anyway, that's being developed, which will bring together, deliberately bringing together multiple data sets to answer, you know, policy relevant questions for government and others. So no, it's a really exciting time. We're not just bean counters anymore.
Thank you. So from Melissa Lord now, slightly different. Have you or anyone tried to get a measure of how frequently people are not reporting COVID, just doing a lateral flow test and not registering it?
Well, lateral flow tests, I think they've distributed, oh God, I got the number, and you know, 100 million of them or something, and they've only had 6 million arts, maybe 16% have come back. No, it came out last week. I've got to make more of this bit of data. I think 84% of lateral flow, you know, only 16% of the numbers distributed, they've only had the responses in 16%. Now, what's happening, whether the others have gone into landfill, people have done them, and if it's negative, can you be bothered to report it? But if it's positive, do people report it? No, massive underreporting from lateral flow tests. They're free, people use them, they don't report them. No, and they've just gone out and nobody knows what happens to them. I mean, this is a real problem with test and trace that was being picked up. No, that was a statistic in the report from the select committees. Again, really criticizing test and trace. Oh, just the money that's gone into that, and all the performance metrics has to do with just the process. How many have been sent out, not whether they've actually done any good or not. So, there's been so much criticism, I think, correctly, of the lack of attention to impact of the test and trace system. Yeah.
Okay. Thank you. And then from Yuri Baslov, what can you say about believing the science? Oh,
well, I don't know the believing the science. There's the following the science, I think, is perhaps the phrase. I can't stand that phrase. It's awful. Just really terrible. And that was used quite a lot at the beginning of the panel. We're following the science, which is nonsense, because science doesn't tell you what to do. It's not there out in front saying, come on this way. I regard the science as sort of wandering along beside you, muttering to itself, arguing, and occasionally pointing down, well, if you go down there, that might happen. If you go down there, that might happen. But it's up to you. Politicians make the decisions, not scientists. And there's a lot of contested science, and it doesn't tell you what to do. So I think, you know, following the science is nonsensical. Possibly guided by the science is not so bad. But again, it's only if you're seeing that the science is only pointing out possibilities on some metrics of what might happen if you do something. Because they're not measuring other metrics that may be very important politically and to society. So science is very limited to what it can contribute in this area, and I think, you know, following the sciences shows that somebody doesn't understand what they're talking about if they use that phrase.
Right. So there are 3 related questions. So one from Jane is, do you think that newspaper headlines are deliberately misinterpreting your statements to get more views? And then
okay.
And then Mia Liddell says, what news sources, websites do you think use the most accurate statistics, or are they all as bad as each other?
Oh, no. Okay. I think the deliberate, no, not that much. There is deliberate misuse. by the COVID skeptics and by anti-vaxxers and Bolsonaro and all those people. They deliberately are cherry picking and manipulating and picking what they want deliberately. No, most of the media are doing it because they don't understand it. That Sun headline is because, and even dear Katie Hopkins just didn't understand what I was saying. And I blame myself, I wasn't clear enough. So most of the time it's because they don't understand. And are actually very quick to correct it if you point things out, because they don't like being proven wrong. So no, I think most of the media are not they may write it up, might sort of egg it up a bit, but generally I think they've been very good. In terms of sources, no, I think the usual suspects. I mean, I like the BBC. I think the Financial Times has done a fantastic job. Oh my God, John Byrne-Murdoch and his team, in terms of both their interpretation of the graphs, been extraordinarily good. But others, The Economist, have been very good. Even The Spectator, I think, has done some good, really good stuff. But the Guardian's not bad. I mean, they carry all our stuff, so I can't really complain. And even the Daily Mail has had some. I've had stuff in there, and they put graphs in, and they put in the stories. They interpret them. It's been pretty good. The Sun, pretty good. They haven't been carrying the the misinformation at all, or hardly at all. I think they've been pretty good. Some are better than others, but they've been pretty good, I must say. Yeah.
So the third from Rolake Osho says, do you think there should be penalties for news misinterpreting information and spreading false narratives?
Well, there are, there is IPSO, and I've complained to them on occasions before, that if someone has written a bad, you can complain to the press regulator, IPSO, if you think that there's an inaccuracy in the story. I mean, I don't think people use that enough. They should be complaining all the time. You're supposed to ask, I've essentially have been phoning up journalists, emailing editors to get stuff changed, saying I'm going to complain to IPSO unless it's changed. And they do. They don't like having complaints made about them. So no, you can complain about it. I mean, so that is a press regulator in a sense. Look at all those bad stats I was describing. It's quite difficult to kind of stop it. Really outsourced, because you can try to counter it. And the Office for Stats Regulation has been publicly complaining about the use of that NIMS denominator, that data showing that case rates were higher in vaccinated than unvaccinated. Public letters written to UK HSA complaining about that because as being misleading or potentially and then Bolsonaro using it, for heaven's sake.
Well, there's a question from Zeba about that. So why would the president of Brazil use UK data? What do you think? It went through a channel that table which showed case rates were higher in the vaccinated groups than in non-vaccinated, just went by. It was passed between and cut and pasted the actual image between different anti-vaxxer groups, and was spread worldwide, and it popped up all over the world. Full Fact, I think, followed it up to 10 different languages and that sort of thing, and it ended up Bolsonaro had a particular bit of misinformation that people had collated, and he was just making stuff up from that. So it was just through this web of conspiracy theory websites, essentially. Right. Okay. So one from Andy Gillies now, which is, how possible is it to actually compare COVID deaths in the different European countries? You said you've done some different analysis, and how do the rules for the medical certification of causes of death vary? Oh,
hugely. That was our last week's article in the Observer. So in Belgium, they're if it's just a probable, they haven't been tested, and just a probable death, they'll go in as a COVID death. Other countries demand that the person was tested positive and died in hospital. As I said, in Turkmenistan and North Korea have not recorded a single COVID death yet. So you can't, everyone does different things. And as so our COVID deaths on the death certificates is an undercount because of what happened in the first wave. So I take COVID deaths with a big pinch of salt, much prefer to look at excess deaths. But those, of course, then you're mixing up the effect of the lockdown as well, if that's been substantial. So it's not perfect at all. So this headlines last week, we passed the 5 million barrier,
Mhm.
you know, was complete nonsense. You know, it's at least twice that. So that was really not, yeah.
Well, that leads on to the question from Peter Corrie, which is, why is there a stress on the number of cases in the daily figures rather than the positivity rates?
Oh, I think so, because the number of cases, I mean, okay, it does depend on how much testing is done. But since the amount of testing being done is reasonably constant at the moment, about a million a day, then the positivity rate would be generally following the number of cases. But the number of cases, I think, is there because it's not the number of infections. I roughly speaking double it, you know, so to get the actual number of infections. So number of cases does give because in the past, it's broken down, there was a pretty strong link. If you knew the number of cases, you could predict hospitalizations in 10 days and deaths in 3 weeks. So there was, you did give you a really good indicator of what's going to happen. And it's still there. As long as you break up the cases by over and under 65, perhaps, because the huge surge in young kids, you know, which there has been, and then a big drop over half term, and it looks like that's continuing. It doesn't have a big impact on hospitalizations and deaths. So but if you know the case rates in older people, you got pretty good marker of what's going to happen in the next couple of weeks for hospitalizations and deaths, and they might very well be coming down. Things might, you know, I'm not going to say, but maybe Plan B might be avoided. So you know, things are better than many people might have thought.
Which is good news.
Yeah.
So one from Ellie now. What did you want to do before you went to university? And did you know that you wanted to be a statistician? Oh,
what a lovely question. Thank you, Ellie. Yeah, no, I had no idea what I wanted to do at all. I was just reasonably good at maths at school. And I just sort of thought, oh, I'll go and do maths, really. And I didn't know anything about statistics because I didn't learn, this is back in the 17th century, we didn't learn any stats at school whatsoever. And I liked the pure maths, I didn't really like the applied. So I just went to do maths because that's all I kind of could do, and because I quite enjoyed it. But what happened then at university, the pure maths got too hard, and about the middle of the second year. And unfortunately by then I'd got a bit enthused about stats or about probability theory. So I shifted attention and then just got to really like it, because it throughout my career, which I'm, you know, I've had a lot of fun. And it's always been this mix between, you know, trying to use the maths I know, but applying it to real life problems, like this COVID stuff. And I haven't, during this epidemic, I haven't been doing really mathematical stuff at all, but, you know, many people have. And there are a lot of Bayesian complex modeling been going on in analyzing the infection survey and all this data massive data that's come in. Some really beautiful, apart from, of course, the mathematical modeling of the epidemic processes as well, differential equations, all that kind of stuff. So huge amount of maths has been used in the COVID epidemic. Mine is quite superficial. It's just due to the numbers. So I guess that's the way I've done my trend. But no, I had no idea what I wanted to do. And didn't know anything about stats, but I was really pleased when I found it, because it kind of merged the mathematical interest with the real life. Yeah.
Okay, thank you very much. Just a few more, you're pleased to hear, but we've got, if that's okay. So, and these ones, it's a collection about understanding again. So from Sophie, do you think logarithmic scales can be misleading because the public does not understand / notice them?
Yeah. I'm very reluctant. I mean, you notice I was using them, and usually, and in the book, I always put them side by side, the natural and the log scale, just to show what's going on. And the log scale allows you to see what's going on down at the bottom, essentially. No, I don't like using log scales with a non-mathematical audience. I really would avoid them if at all possible. We really struggle with this all the time in risk communication or low probability communication. When you're talking about orders of magnitude, very difficult to communicate. You know, it's really is challenging. Again, it's something that everyone struggles with all the time. You can put them on a log scale, then people just see them as equally spaced. So that is a real problem. but no, I would try to avoid them for the general audience. Absolutely, yeah.
And then from Nigel Thomas, do you think that a time where the majority of the general public are able to properly understand the statistics the media throws at them is possible, or is this just unrealistic?
Oh yeah, no, people have got, there's fairly low numeracy in society on the whole, and so I don't understand. I think many people, I think, always find it's quite tricky to really feel comfortable with them, but that's why it's on the onus, I think, of the communicator to be really clear, to really help everything that, in every way they can, through the use of graphs, stories, images, etc., to make clear, what is the main take-home message from this, because numbers don't speak for themselves. I can make any number look big or small. Just tell me what you want. I can do it, and a good journalist can do it. So I can make a number look frightening or reassuring, exactly the same number, merely by the comparators that I make. And so numbers don't speak for themselves. And so that's why, in my talk, I'm always pushing it back on the onus is on the person doing the communicating to do it well, rather than, blaming the audience for not being clever enough.
Right.
But it would help. I do also believe that we should be, training, as we talked about earlier, improving the data literacy of the population. Just like their numeracy, we need to try to improve it. Yeah. So it's both ends.
Just a note from Abigail Bown on that note, that some of what we were talking about earlier is taught in this post-16 course, core maths. Maybe that should be compulsory for all.
Thank you, Abigail. No, I'm a huge supporter of core maths. I was on a group with Tim Gowers that was setting up the core maths syllabus and then designing some of the materials. I'm a huge supporter of core maths because it actually encapsulates so much of what I'm talking about, because it's to do with, with important problems and sort of mathematical thinking, but where an element of judgment and thoughtfulness is required, rather than just carrying out the mechanics. Thank you, Abigail. Cool.
And from Susan Duff, which is more on what we were saying earlier, do you hope that this increased prominence of statistics in the media and the government will continue? And could it help hold decision makers to account, or is there actually a real risk that the perceived trustworthiness or not of the decision makers means the statistics gets tarred with the same brush regardless of the source? Yeah,
no, that's very good. No, I again, this is to do with data literacy. It's trying to get people, rather than either sort of having to believe all statistics as if they're God-given truths, or just rejecting them because, there's damn lies in statistics, stupid things like that. They're realizing that there's some are better than others. There's some that are really trustworthy and others that are not. And just because it's a number, that ability to sort of critique a number and work out have an idea of its trustworthiness is an extraordinary skill. I always say you've got to sniff the number. Just because there's some really smelly numbers around, and you've got to get, and you have to develop a certain nose for bad numbers. So I don't know, maybe I'm always optimistic. I think that the increased attention it's made the press, the media far more sophisticated, I think, in their handling of numbers. I think it might have made politicians a bit more aware, and certainly policymakers, I think. And I kind of hope, but again, I got no evidence for it, that the public has become a bit more sophisticated in realizing that, some of these things, because there have been people saying, these are just a case demic, blah, 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 and realizing, no, actually, these numbers do mean something. They got a whole lot of cases, and a few weeks later, people are dying. That you can measure these things. They're not just stories. You can actually see these things happening in front of you. Yeah. So I'm optimistic, but I think we've all got some responsibility, and who work in this area, to improve the discourse around numbers in society, and that means being able to try to tell the smelly from the ones that are slightly more trustworthy.
Thank you. I think just just two more. One is a technical question from Oscar B. How can extreme value theory be applied to cope with statistics? Is there a way?
Well, that's a very interesting, because extreme value theory is an extraordinarily powerful thing. I'm familiar with it being used in things like, ships sinking and things like that. I mean, essentially, it's a theory of trying to predict things that are bigger than has ever happened before. It's the sort of, really heavy tail distributions that allow you to work out the chances of things happening that have never happened. Which I think is very, maybe I'm not like COVID now, maybe if people had been a bit more thoughtful about that when planning pandemics and realizing that things that have never happened could happen, that might have been more valuable. But that's sort of Taleb, Black Swan sort of area. I mean, the theory of extreme events, I think, yeah, and maybe in sort of historical approach to pandemics would be a natural application of that. Yeah.
And then I think a good question to finish on also, because it's the final question, is what are the main points or sort of the final closing thoughts you'd like the audience to gain from your lecture?
Oh, that's really sweet. And thank you.
From Nachima Giffen, I should have said.
Yeah, Nachima Giffen. Thank you very much. Oh God, I don't know. Oh dear. Oh, I think that numbers are great, but you got to sniff them. That you got to be careful with them, and that it's actually a really good skill for everyone to have, to be able to kind of pull apart a number. But it doesn't mean just being, statisticians get accused of always being negative. I think that's a real problem. It also to really appreciate the power and the value and the beauty of good statistics. So maybe that's, I'm not sure, that's too good a question. I can't think of a neat answer, but that sort of idea that there are these lovely things and there is stuff that isn't great at all, and that it's a really valuable skill that we all could cultivate to try to see where things are on that spectrum. Yeah.
So with that, I'd just like to thank you very much for your time and for the lecture, to thank everybody in the audience for listening and for all your questions. It's been extremely stimulating. It's been a wonderful event. Thank you ever so much, everybody, and see you next year at the next one, which we hope will be back in person at the University
Yeah,
campus.
Can I just thank you all for organizing it and letting me do this, and everyone in the audience and asking the questions. And I'm so sorry I couldn't do all this in front of you. That'd be fun, and then go and have a drink afterwards and shout at each other. Yeah, that'd be great. Never mind. Next year. Okay.
Thank you.
Bye. Thank you very much indeed. Okay, bye.